Cancer journey does not end after the completion of a certain treatment plan. Patients in many ways require ongoing follow-up. Scans and follow-ups are important in certain time intervals to achieve early detection of a recurrence and eventually a life-saving intervention promptly. When an appointment is due or a scan is due, we make sure we send a reminder to patients and book necessary travel for those coming from the community.
Caring for someone after their initial treatment and recovery from that initial treatment is a prolonged but important part of treating someone with cancer. It usually involves less follow-up and less interactions with our patients, so it's critical to make sure that we communicate what plans we did have in the next few years, whilst also not imparting too much information about what's going to happen in 5 years' time versus what's happening in 3 months. For Aboriginal and Torres Strait Islander people, that will involve usually engaging with appropriate health professionals both in the primary site and also in the towns in which they live, and that will be engaging with Aboriginal health workers, allied health professionals and Aboriginal health practices and their GPs to make sure that they're in tune as well, and so that they know when I'd be expecting the next follow-ups to occur. Making sure that they have contacts is important because people feel empowered, and particularly in Aboriginal and Torres Strait Islander communities, sometimes the links with GPs or tertiary level care is not as good as in metropolitan settings.
It's important to reiterate with the Aboriginal and Torres Strait Islander patient the importance of informing them about follow-ups and why we do the follow-ups and how important it is for them in regards to their general health and well-being. Because Aboriginal and Torres Strait Islander people, once they've completed treatment, their only focus is that they'll be returning home to their family and country. It's important to have good contact and relationships with the primary health care out in the community centres, advising them that the Aboriginal and Torres Strait Islander person will be on their way home, and send documentation to them in regards to the patient's treatment and also post-treatment care. And also keep in contact with them in regards to any follow-up appointments or any other care factors that might need to be addressed while they're in community.
So after the initial treatment, it's very important to engage with these clients and keep them engaged with receiving their treatment, because sometimes, when they do go home, returning and continuing their care may not be their first priority. And we want to give them every chance to receive all possibilities of treatment to obviously help them get through what they're going through. So referring these patients to Aboriginal Medical Services, the Aboriginal liaison officers at the hospitals, cancer support staff, social workers, obviously just try and keep these people engaged, because we have to be respectful of their wishes. They may or may not want to stay at the hospital to receive the treatment. They may want to go home to country, or may just want to receive treatment at home, and obviously we need to just cater to their wishes.